Good day to class today, and today we'll be discussing the module 10, module 10A. Just a brief recap on what we did in our previous module. We talked about food, nutrition, and nutrients, and we're able to understand a lot of concepts of nutrition and foods, what it means to have high diet, what it means to have low diet, what are the patients that are indicated for this type of diet modifications. Today we are moving quickly to introduction to family spending and budgeting. Introduction to family spending and budgeting. You may be thinking, why are you getting involved in family spending and budgeting? As home health aides and personal care aides, one of our core responsibilities is to assist the family or the patients we are taking care of to manage their family spending and help them to set a good budget. Because if we look at everything we've discussed so far, we'll see that certain in the aspect of cooking, aspect of welfare, all these things needs money. We can't necessarily or we can't effectively assist well where there are financial constraints. And of course, we all understand the situation of the country. So we need to understand what family spending and how to budget. So without wasting much time, we're moving to the introduction aspect of our topic. Now, home health aides or personal care aides may be asked, as directed in the care plan, to assist their patients and their family with developing and sticking to a budget. Now, they may also be asked to assist the patient with paying bills, running errands, such as probably groceries, shopping, or banking for the patient, especially patients who are bedridden or patients who are not able to move from one place to another, who couldn't perform activities of daily living. So may even help them to spend, to do family spendings, like getting things from the shops, getting groceries, or even going to the bank and banking for them. So it's important to remember that assisting someone with their money is a task in which accurate record keeping is paramount and very important. There are some cases where there used to be a saying that if there is anything that can bring disunity among brothers, it is money. Yeah. So when it comes to spending, you need to keep an accurate record of every dime, every kobo, every naira you spend. So you have to work. It's very important to keep accurate record. So at home health care aides and personal care aides, we must also always be careful and immediately document how much the patient's money they've spent and what they spent it on. So when you are able to document, I think I said in one of our classes that documentation is a key major aspect of any medical practitioner. Be you a nurse, be you a healthcare practitioner, be you a home health aide, be you a personal care aide, observation, documentation. Now, talking about documentation is very important because if you don't document, there is no legal tender of whatever you've done. So carefully spending and documenting everything, not just inaccurately documenting, but accurately documenting them on what you spent and how much you spent and what you spent them on. So home health aides or personal care aides should only provide assistance with managing and handling a patient's money and budget as directed by the care plan. Their employer will tell them the policies and procedures for the agency they work regarding whether or not it will help with handling the patient's money and what the rules are for doing so. So it is not mandatory that you help all types of patients, all categories of patients with your spending, family budgeting. So it is only if directed, but then we need to keep this under because it's an integral part of our duties. If directed by the care plan to help or assist in family spending and budgeting, you'll be told to do so, and the rules are guiding guiding that. If home health aides or personal care aides are not allowed to handle money, they must never agree to do so, as they could get into a lot of trouble and potentially lose their job. When you do what you are not asked to do, you are guilty, even if you were right. And there's a difference between being right and being legally right. So you may be right, you may be good enough to have been able to assist, but then in case of a legal tender where you are not asked to, you are not empowered or given the rule to do it, and you involve yourself in family spendings, you may be called a thief. Many things could happen. To go rough, to go sour, and then you have yourself to blame. So never agree to do so unless you are asked and you are permitted to do it. If the patient or the family member asks a home health aide or a personal care aide to handle their money and they are not allowed to do so or do not feel comfortable doing so, they should discuss this with the supervisor and seek their guidance. There are different rules governing home health aides or personal care aides work cover, like the things you cover in different geographical locations and different places. So depending on your location, if you are not permitted to handle the patient's budgeting and spending, and the patient wants you to, do not just take laws into your hands. We've been saying this over and over again in our previous modules, talking about different things, and the whole hammer on is do not take laws into your hands. Always consult your supervisor if there is anything that feels confusing or controversial. If you don't feel comfortable handling the patient's money, even when you are allowed to, discuss with your supervisor. Or if you are not allowed to, yes, the patient wants you to, or the family wants you to, they ask you to help them with their money handling and the likes, you also want consult your supervisor to seek guidance. So even if part of their job is to handle the patient's money, home health aid and personal care aid should never use the patient's money for their own needs, even if they are planning to pay them back. When you see the word never, it means there is no negotiation on no account, on no scenario possible or whatever should you use your patient's money for yourself. You are not allowed to borrow money from your patient. It is considered stealing, because when you take something that is not yours, even with the intention of returning it, before you would return it, what if something happens and you are asked to tender? That means what? There is no explanation for that. You have undoubtedly stolen the money. So you could lose your job, or you could get the agency that is covering you in a lot of trouble, and you could face legal or criminal actions. You may even get arrested. The documents used for the patient's document use of patient's money are directed by the care plan and the agency's policies and procedures. So you use checks instead of cash whenever possible. And this is the easiest way to accurately keep track of how money was spent. When you spend in check, all these checks are there's the paperwork. There's the paperwork of everything. It is written. It is easy to track how you spend money than just spending cash. But if there is no check, even when you are using cash, accurately document how much was spent. But it's much difficult to keep track of cash, of course. But the patient must sign the checks, which demonstrate that they intend the money to be used for the purpose they are signed. Now let's look at income. When we want to talk about family budgeting and spending, there must be income. Before you can spend money, that means money is coming in. So there is no way we can spend what we don't have. So what is income? Now income is talking about what? It's that amount of money, it's that amount of cash price, that amount of price that comes in at a given amount of time. Now, incomes are most time fixed, and it may not be fixed as well. But for most families in this geographical location or this 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 side of the world or this country, we or even wages or their fees, a certain amount is coming in. So many people, including patients and their families, may live on a fixed income, and a fixed income means that a person lives on a set of income and must plan their expenses in order to fit into the amount of money that they have incoming. So imagine you are receiving 20,000 every month, and that is a fixed income. 20,000 every month. It means that you must plan all your budgets, everything you are spending within this amount, this 20,000. Because when you spend above your income, you will run into what? Debt and a lot of losses. And when you it's better to spend below your income so you have savings than to spend above your income. So people who may have income from a variety of sources, and income is the amount of money that enters the amount of money that is called income. Income now, some people may have income from different sources, maybe a farmer and also a teacher, or let's say a farmer have income from two different sources. To fix, get a paycheck one value, all these are sources to be helping their. They must first know the amount of money that is coming into the household in order to make a plan. Now, if you don't know how much is coming in, there's no way you can make a good plan. Because if let's assume that incomes are coming in from three different sources, and although they are coming from three different sources, but then there may be some total of every amount like 100. Now you must know that in a month, following this sequence, either bi-weekly or monthly or even weekly, so amount is coming in, and the sum total of all the amount that is coming in, then with that we can make a plan on what? On budget and on spending. So the patient will be sensitive about the amount of money they make. They will be judgmental about the amount of allow your patient to move far, but offer assistance when needed. Some patient may earn quite a little, while some patient may earn very huge. So you cannot be judgmental. You shouldn't be judgmental, and to I'll call it prognosis. I don't know that word is actually correct, but then you know to be talking those, you know, talking those into the patient's privacy. If the patient because it is too much, I don't want you to know about it, or it is too small, allow the patient to manage their budget independently. Or you can only make assistance when needed. Only when you are allowed to handle the patient budget should you, in any case, should you take it. So some patients may prefer to complete a complete assistance with planning their budget. So a care plan will direct the home health aide, the personal care aide, as to how much assistance they will provide their patients and their family with managing expenses. So let's look at debt and stress. Now, we've considered income and we're able to understand what income is and how patients, how most patients dwell or depend on a fixed income, like a fixed amount of price coming in. And let's look at debt and stress. Now, these two things are looking quite different in words. Debt is not from stress, but then they are interrelated in what? In our in function. When you run into debt of house, now does it work? Now, many people resource money can be a real source of stress for many people. If we are unable to buy things we need or want, it can cause a great frustration, anger, depression, and a lot of bad feelings. So when people spend more than the amount of money they have or they make, they incur debts. Now, we see that in Nigeria currently, everything is going high. Cost of feeding high, cost of living high. everything is getting more expensive, but wages and salaries are stagnant. None of it is going high. So we see that the money we earn, if we calculate our wants, even sometimes our needs are not even met, yet we have a lot of wants. So when we are able to buy things that we need, now starting with need, these are the essential things that you need at the particular point in time. What I want are those things that cannot be met, everything that we want. So when your needs are not even when your needs are not properly met, talk more of your wants. All these things can, create frustration. You need to get, you need to, you need to pay for meter bills. You need to pay for water, utility, like everything. And the amount of money that is coming in cannot even cover up all these needs. A person may end up incurring debt. So debt is money that you owe. You begin to owe people, you begin to owe money. And the moment you start owing, your stress level begins to increase because why you're thinking, how can I pay this money? What can I do to give this guy? It becomes very stressful. So some people may incur debt by spending more money than their income, and they may borrow money from family or friends, or even lending it from agencies or from banks. And they also use credit cards to purchase items that they cannot afford. So debt is a load. As much as it is better to look for means of increasing your income than to incur debt. No matter how great your needs are, never spend out of, never spend above your income, because it is literally unwise to spend above income. You understand the fact that, let's assume that 50,000 is coming in every month. Now, 50,000 coming in every month is not even enough. Now you went on and borrow a 50,000 extra. So you have 100,000 to spend on your contract. And having a deficit of 50,000 to pay. Knowing fully well that your next pay will cover up the debt. Now, what do you live on? If you can't live on a 50,000, can you now survive on a 0,000, zero body, zero account? So it is more wise for you to spend within your budget than to spend above your budget. No matter how grievous, how great, increase your income instead than incurring debt. If a person does not pay their credit card bills on time or in the full amount due over a relatively short period of time, a higher amount of money than what the person borrowed becomes due. So if you borrow money from agencies, from banks, from credit, loan from loan sharks and the like, you are given an ultimatum and a time to pay. If you don't pay at the appropriate time, the money begins to increase, even add interest. And trust me, you can't even borrow 10,000 and return 10,000. When you borrow 10,000, you have to return like 12, depending on how the interest rate is. And the longer you spend for paying, the higher the debt. So you see that it gets even more complicated because why? Your budget, the some money coming in is not even enough to settle the bills. Yes, you are incurring debt, and the debt was incurring more dues. So this is because credit card and lending agencies charge is what they call interest. So they charge you, and that's what they call their interest. And interest is the amount of money a person pays on top of what they have borrowed. So when you borrow money from lending agencies or credit card companies, we are charged interest. And this is the cost of allowing us to borrow the money that we do not currently have. So we see that it's even more complicated to borrow money. In a wise sense, it is not advisable to borrow money. Because you will later on pay back more than what you even borrow. But if a patient has a high amount of debt and is having difficulty paying their bills or loans, home health aid and personal care aides can speak with the provider about what option their patient has. Many communities may have credit counseling services available to help the patient and the families manage their debts and plan for living expenses appropriately. So as a home health aid or personal care aides, we think that our patients will benefit from this type of services, they should discuss this concern with the provider to get it for them. So if the home care team will be able to provide budgeting assistance and maybe referrals to community agencies to help the families with this type of need, the best way to reduce stress about money towards budget and plan for expenses. Budget and plan for expenses. Expenses will always come, For instance, except for emergency expenses or emergency budget that you don't plan for, talking about house rent, talking about even child birth, talking about everything. And these things gives us time to prepare. Imagine childbirth gives you a 9 months space of time to prepare. You have a 9 full months to save for your wife's delivery. So if you don't plan budget well, you may not save for delivery and start looking for how to one time get to figure out the money, pay for delivery fees and everything in the hospital. You see, when this occasion comes in, you run into what? Into debt. So let's say that house rent. The house rent gives you was a year time, a year. It is 65 days to prepare for the next rent. But if you don't plan the right account, so many things gives us time, even if it's even who run a 6 month semester or even 3 months to save up, to prepare, to save about money, to what budget properly and plan for expenses. Now let's look at the daily expense tracker as one way we can use to help in what budgeting and planning our spending. One way to determine whether the money, where the money is going in the household, and the value set of a budget is to keep track of what really expenses for a short period of time, for a period of time. Now, if you don't know how you spend, you discover that you may have 100,000 in your account and eventually this even too much. Eventually it's gone. I'll be like, how did this money do? Some money are spent on things that are not even valuable, things that are not even useful. Now, if you don't keep a good track of your budget, you will not know what you have spent on. You can't keep track of everything in your brain, in your mind. You have to keep a written record, Plan every penny, plan every dime, plan everything you have. If you have a money that any unplanned money will go for what? Unplanned things, or things are not even useful. So one way we can use to determine where the money is going in household is plan a budget or just a daily expense tracker. So this can give a patient and the home health aid, the partner care is useful information where money needs to be allocated, that's where money needs to be distributed to assign to a particular category, or where spending cuts can be made. Where is the money going to too much? Is it important for the money to go in there? What about this part? Why don't we shift or redirect our spending and spend more into this than this? So cut budgets and what? Improve budget, allocate budgets. When doing this, it is important to keep track of every item that is purchased, even if it seems small or insignificant. Be it the smallest thing. Keep track of everything that was purchased, because the buying thing of 10 naira, as small as it is, 1,000 minus 10 naira gives you 990 naira. You have a deficit of 10 naira. If you have to get something that is of a 1,000 naira cost, you can't buy it because of what the 10 naira short. So every little amount counts. So when doing this, you have to keep track of every item that is purchased. And oftentimes, people may not even realize the amount of money they spend on other items. So much on sodas, on junk, on things that doesn't really count. So this can be helpful. This can be helpful cases to cut back on expenses without too much hardship. So you can make a daily expense tracker in a software program such as Excel or using a Word document. You can even keep track on a piece and the amount of money you spend. If not this expense tracker, you can know how much do I spend in a day, in a month. So keeping a track of a hardware document that you will write it out on a piece of paper, labeling the amount spent, the type of expenses, and the dates of the spending. This is an example of the daily expense tracker made in hardware. So you see the description, what was bought, the category, and the amount. Description, what amount, then date, and what total expenses altogether. So moving on to the next point here, daily expense tracker worksheet contains what? The date, the type of expense, the amount. And for an example, to look at it here, on 1/15/2015, that's the date. The type of expense is gas for car gas station, and the amount spent that day was $20. Now, on first of on January 16, 2015, goes to the market, $7.5 was spent. The like the red guys coming down to what cleaning product and grocery store and everything. So now, if you look at it very, you can sum the total amount of what of expenses all together, and you have spent above your income or you are spending below your income. Well, it will help you to maybe applying a good uh, budget or a bad budget. While some of these items are necessary, such as gas for the car or groceries, other items such as gum, these kind of items can add up in the long run. Uh, yeah, often items forget about money or we are trying to figure out, yeah. So quickly now, I'll share my screen so that we can continue from where we stopped. Share documents already. So continue from where we stopped. We're talking about planning a budget. Now, like I said, a budget involves planning for expenses within the limits of the amount of income. Now, people often find it helpful to set up categories of expenses when planning their budget. And the first step is to determine all the household expenses. Household expenses like groceries, like feeding, of course, like clothing, utilities, all these are family or household expenses. So we have to determine that first. Then second step is determine all sources of income. Then once all data has been collected, a person will be able to determine if monthly uh the monthly income meets or exceeds or is lesser than the monthly income. Expenses. So we'll take a look at how to determine the expenses and what income next. So this is an example of budgeting. Now, in budgeting, we'll say express later by a pictorial representation. The express say, so saving now gives you this page for planning, planning for expenses. No unintended or unexpected topic. The next step in effectively managing money is towards determining what the actual expense of the household are. Now, expenses are is light and water. Both are quite important, but you cannot negotiate water for life, or you cannot negotiate feeding for may may all have necessities, but they are much more necessary than the other. One is much more important. The actual expenses are those expenses that the patient and family has. Something them they may not be able to survive. So that is what they survive on. The basic needs of the family. So this includes like rent, like mortgage payments, car payments, health insurance payments, groceries, gas, electricity, water, tuition for schools, prescription of medication, prescription cost, and what? Gas for car, clothing. Now, see how these things are arranged. As much as all this, in fact, based on the patient and their family's unique needs or the type of expenses will vary. So depending on the patient and their family's unique needs, what the types of expenses will vary. How do we mean here? Depending on family size and what the family type, family culture, family values and beliefs. So every family is unique. We all know that. So every family has its own unique needs. And as much as we all are unique, even in needs, our expenses will definitely vary from each other. So as home health is a personal care, we discuss with our patients the expenses they have in order to develop it. Remember never to be judgmental in how a patient spends their money. People choose to spend their money on different or money in a very different way. Home health aides or personal care aides may not agree with the way their patients spend their money, just like the patient may not agree with how the home health aide or a personal care aide spends their own money. Remember, it is important to remember that it is the patient's money. Just as a paycheck is the home health care aids of patient's money. So your patient's income is for your patients. As much as we want to help them plan a budget, we have to consider their interests and don't be judgmental in how a patient decide to spend their money. So don't be judgmental in how they spend their money. Just like no one cares about how you spend their money, but we care about how they spend, as we want to help them. but we are not to be judgmental on how they determine or spend their money. If they are allocating social amount for social thing and some for social thing, let us respect that decision and what plan the budget regarding their decision. So remember that it's the money, just like your paycheck is your own money. The home health care aid or personal care aid job is to what? Assist the patient with being able to plan effectively so as to reduce their stress about money and to live independently and according to their income restrictions and preferences. Home health aids or personal care aids can also determine expenditures, family expenses. Now, you could do this by a spreadsheet, a Word document, or a piece of once before you can see your expenses and how much each cost the family on a monthly basis. They should then add up the total expenses. Now, an example is the expenditure and the cost. So, like rent or mortgage, automobile payments, automobile insurance, health and dental insurance, homeowner or renters insurance, life disability insurance, then child support or alimony, food and electricity, gas, water, garbage, education, like nutrition supplies, like prescription medications, cleaning supplies, clothing, household items, personal care like hair and nails, health club membership and dues, entertainment, subscriptions, then total expenses and total revenue. I hope that part is understood. So let me just give you a basic recap in case of for more understanding. So after we list out the family budget, total everything, the total expenses, and the total income. So you subtract. So we know if the total income is more than the total expense, or the total expense is more than total income. So how do we determine income? Once a home health aid or personal care aids are figured out, the expenses they need to determine the amount of income the family or the household has. So once we figured out the expenses, you need to what? Determine the amount of income the family household or the household has. And this is done by writing down all the sources of income and the amount of income from each source. And an example of this might look like monthly income worksheet, the income source, the amount of income, salary or wages for the patient himself, salary or wages for the wife or any other person, social security and unemployment, child support, alimony, financial aid, scholarship, pension, or plan retirement, all these kinds of income. The full start, the total income and total. So now that we're able to figure out all the expenses here, like talking about examining all the expenses, like all the types of income. So we are able to figure out expenses and the amount of income for the month. Now we need to now figure out the balance left after expenses. So how do we do this? After being able to ascertain the expenses and total income from every source, now you find this is the amount left over. That is the total amount of income from the total monthly income with the amount that is left over. So how do we know this? You may find that the total monthly expense exceeds the total monthly income. And in this case, they will need to assist the family towards determine where expenses can be eliminated. So here's an example. If the total monthly income is $5,300 or in naira or whatever currency that paid in, and your total monthly expense is $4,750. So we subtract this 4,750 from 5,300. And what do we have? We have 550 as the leftover after accounting for all the monthly expenses the family can of the family. So now family cannot decide to put this money into savings, in other words, build up for retirement savings or pay for future college expenses or save for expenses that are not planned, just one expected cost and the likes. But here's an example of what a X institution where the expenses exceeds the monthly income. Imagine you earning or your parents earning like $6,250 and the total monthly income is 7,500. So how much is left over? You have a deficit of $1,250. So what happens? To balance this debt, to balance this deficit, the patient or the family may have to borrow. So in this case, the family is spending 1,250 more than what their income is. They need to make an adjustment to their spending in order to live within their means. Else, they run into debt and which was increase was stress. So we have come to the end of this first module on family planning, how to plan a family budget. So we're able to understand that the best way we can help our patients, which is a summary of everything, is to help them plan an efficient budget and what? Make sure that you minimize their expenses to be within their what? Their total monthly income. Else, they should what? Find a means to increase their income. A patient who has a leftover of 1,250 in the next month will incur another 1,250, making it a 2,500. If this goes on for 4 consecutive months, give us 5,000 deficit. If this goes on like that, it becomes 6,250 now of it has been owed. So if such a person decides to pay his debt without increasing income, what happens? He has nothing to dwell on. So the best thing we can help our players is to help them plan a budget that is efficient, that is workable, and that is perfect. So before we end the class, we plan to make a brief recap on what we discussed in this module. And here we talked about introduction to family spending and budgeting. We'll talk more about these in module 10B and module 10C. We'll talk more about it. So here we'll talk about the introduction and we'll talk about what the family budgeting is, what spending is, and what are the rules and what to do and what not to do when it comes to spending for your patients and how to spend for your patients. Where we talk about using checks where it's available more than what cash, because we can account for checks than what we account for cash spending. Then we talked about income. What income is as what the total amount of money that enters into a patient, a household, within a period of time, either within a month, as not within a month, a particular month. So either the money comes in bi-weekly or weekly, the total amount that comes in a month is called income. And most that we also talk about that the fact that most patients dwell on what? On fixed income, while others receive like pension and other means of payment. So the total amount of money that comes in is called the total income. Then we also talked about debt and stress. How that a patient who spends more than he receives will run into debt, and how that this debt can what increases their what frustration, their depression, and even their stress level. Because normally, on a normal base, not being able to get what you want can be frustrating. But then spending out of your means can be much more frustrating because you get a high amount of debt insured. Then we also discussed daily expense tracker as one of the things you can use it in a month, starting from how much was spent in a day, every day to every week to every 2 weeks to every month. With that, we can know the total amount that was spent in a month, and we mention that we should not pay blind eye on even little things. So regardless the size or the cost of the material that was bought, everything that was bought should be recorded. Then we also mentioned how to make this type of daily expense tracker, plan a budget. And we discussed something that is important, that planning a budget must first understand or know the total amount of money that is coming in a month. Then you can now plan a budget on it. And our budget must be lower than the total amount of income, so as to have savings and prepare for either future or prepare for unexpected costs. But then when the patient is spending more than they get paid, so you see that it is either they have to limit their budget, limit their spending, or increase their income, so as to have an effective budget plan. Then we talked about uh, our duties as home health aides on determining income. So when we're able to determine the income of our patients, we will able to determine the cost, the amount of money that was spent in a day. So bringing these two things together, we can now plan an effective budget. We can now get a good track of how much was spent and how much was earned. Then we can subtract how much was spent from how much was earned. Then the resulting total gives us what we left over. And when the leftover is positive, it means it is greater. That means you have things to save. But when it is negative, that means it is lesser, it is deficit. Then it's when we keep incurring debt or have to increase their income. Thank you for your time and your listening. Have a wonderful day ahead. Welcome. Welcome to Module 10B. In our we discussed about family budgeting and family spending. Good day, everyone. Welcome to Module 10B. And our previous module, we discussed about family budgeting, family spending, and planning a budget. Today, we'll be discussing ways to make the most effective use of family finances. Ways to make the most effective use of family finances. Now, if you look at in a community of different family and different groups, so family live better than the other, not necessarily because they are earning higher than the other family, but because they were able to effectively plan their family finances and use them effectively and well. So you may plan your 100, let's say a thousand naira for a meal. So let me set an instance before going in or diving in fully. Two men were given 1,000 naira, and one went to the store, bought tomatoes, bought 2 cups of rice, got Maggi and a little ingredients, and was able to prepare what a good food. He eats to his satisfaction. But the other went to a store, bought bread and coke. Now, amidst these two persons, we understand the fact that the one who spends wisely will even get more nutrients from what he has eaten and also gets more satisfied. So we see that it is not really about income. Fine, income is important. You need to earn well to live well. But then it's not just about earning well, it's about what? Planning what we earn well. So without wasting more time, we'll move to the introduction. In addition to helping the family plan a work, to plan a workable budget, the home health aides or personal care aides can also help the family to cut or reduce their costs. And how can this be? Costs can be reduced in many ways. And we often do not realize all the little things that we can do to cut our costs. Saving a little bit here and there and cutting back even just a little can add up in the long run to a big saving. Like I said initially in the previous module, that if you are given 1,000 naira and 10 naira was cut from it, believe you me, it is no longer 1,000 naira. So as small as a 10 naira can be, it can change 1,000 towards hundreds. It can reduce. So cutting up a little bit from a place and adding up in another place can really drastically change what the financial stability of the household. So here are some ways as home health aides or personal care aides how we can help our patients and the family to cut costs and things they can think about doing to help the family to save money. So how to save on groceries? Start with groceries. How to save on groceries. Now, pack lunch and snacks for work, for schools or trips to avoid spending money on fast food or junk food on the road. You're traveling, pack lunch or snacks for your work or to school or to journeys to avoid spending money on fast food or junk on the road. Check expiration dates in the refrigerator and pantry and use items that will spoil sooner first. When you reduce the amount of things that go to waste, I think you will increase the amount of things that come to stay. So use grocery circulars, advertisements, and coupons to select foods that are unsafe to prepare for meals. Then plan meals for the week and write a grocery list of items needed. Look through the refrigerator and pantry to see what items are on hand before buying them. Don't just buy things. Look, what things do I still have? What am I low on? What can I manage? Don't just buy so much in excess. Because if you buy in excess, then you're going to spoil. So use those items to plan meals and you stick to a grocery list while shopping to avoid spending money on extra items. Don't shop on an empty stomach, as you will be more likely to buy unnecessary items. When you shop on an empty stomach, and you're going, you see this you want to buy, you see this you want to buy, and all those junks, they wouldn't satisfy you, but they are quite expensive and they burn your finance, they burn your cash out. Find protein sources because in a less expensive item such as dried beans and eggs, like instead of getting expensive proteins, you can get a lesser expensive proteins to buy. When you buy bulk items, larger amounts tend to be cheaper. So buy in bulk. Stop buying if you want to buy things you know they are for family use. Buy them in bulk. It becomes cheaper and even handy. So, but don't buy extra if they will spoil before you use it. If you want to buy, you can buy in bulk, but don't buy extra. Don't buy too much. When they are too much, either you want to finish them on time to prevent spoil, or they spoil. So buy generic or store brands to cut your grocery bills. Then shop at a large supermarket or discount grocery stores rather than convenience stores such as gas stations, as you will get better prices and sales. You go to a big shop where you can get wholesale prices than just all this, retail seller that sells to earn more gain. Then you buy fresh fruits when they are in season and incorporate seasonal fruits and vegetables into your menu planning to produce a cheaper, fruit is cheaper when it is in season. If you want to, if you are adding some types of foods into your diet, like maybe you want to eat fruits, good. So fruits that are in season are cheaper than fruits that are out of season. So you plan your diet based on seasonal what fruits. Incorporate seasonal fruits and vegetables into your menu planning. So when a particular food is in season, buy and eat. Can buy if there are things that can be saved. Let's say yam. When yam is in season, it is cheaper. So when it's out of season, it becomes what costlier. But then yam's durability can exceed, even when it's out of season. So you can get things and store for what when they're out of season. So avoid processed foods and already prepared foods, as this is not only less healthy but also very expensive. Because why? We practice so many processes to arrive at that, so it tends to be more expensive and what less healthy for consumption. So secondly, now is how to save on household costs. We've learned on how to save on groceries. Now, what about household costs? We have to cancel all unnecessary subscriptions to magazines, cables, and other services. Whatever is not necessary is not necessary. There is no two way about it. It is not important. Yes, that's it. It is not important. So cut out everything that is not important, like magazines, subscription to magazines like cables, like other services. Let's say delivery services. You can get things for yourself. Why pay for delivery? So, except for cases that you need them. If not for necessity, in as much as they are not necessary, you cut them short. Find cost saving plans for combining utilities as cable, phone, and internet services. So there are some plans that saves cost or that combines utilities, such as cables, like that is the television service, like the phone services and the internet service. Pay your bills on time so that you will not incur costs, because many companies charge a late fee which can add up significantly over time. Now, work with a consumer credit agency to effectively manage debt and consolidate credit card debt. Don't use a disposable paper product such as paper plates. Get a good plate. Get a plate that is durable. You can use and reuse. The more you use disposable plates, the more you keep buying plates, and the more you keep incurring a lot of cost on what on plates. So these are examples of household costs. So use cloth diapers instead of disposable diapers. You can alternate for what? Cloth diapers instead of using disposable diapers for children. You can also buy clothes when out of season. Buy clothes when out of season, that is this festive period, and store them. You can store them for when we are in festive period. Now, what do I mean here? Christmas clothes are costlier at Christmas. During festive period, things are unnecessarily expensive. So you use the amount of things you buy, amount of clothes you buy at festive seasons. So you can store, most stores discount, uh, they discount them when they're out of season. So you can get them and store them to when they're in season. To keep causing a good repair to avoid having to replace it. So when a great coat has a little tear, you mend this and even prevent it from tearing so that you can have what a longer durability and lifespan than just to replace them. But the money you replace the one you spend on clothes. And look at store advertisements and weekly circulars to purchase cleaning and other household products that are on sale. You can take advantage of pharmacy discount programs such as purchasing a 3 month versus a 1 month supply of regular use medications. Oftentimes, these types of programs can help to save costs on prescription medicine. Then use the generic brand of a medication and over-the-counter medications when appropriate. And after discussing this with a physician, purchase gas for your car at the least expensive gas station and when there is a gas sale. Now, I would like to spend a little bit of more explanatory. Well, I'd like to be more explanatory on this purchasing gas for your car at a least expensive gas station. That's something that you leave. We have to be careful with cheap things. Let's say that you have to spend 1,000 naira extra cost to get to a place where a good is cheaper. So you have to follow me from here very carefully here. You spend 1,000 naira extra cost on getting to get to a place where goods is cheaper, and you want to buy something worth of 5,000. If you bought, you want to buy something of worth of 5,000. Now, if you buy this thing that worth of 5,000 in a place where you think it's expensive, you may buy it for 5,500. But in a place where it's cheaper, it may be sold for actual 5,000. Now, if you need to transport yourself to that place with 1,000 naira, now if you add the 1,000 naira to the 5,000, you have what 6,000 naira expense already. So you calculate your cost, the total cost incurred. Now, you want to get a gas for your car, it's a less expensive station, but you have to drive kilometers to that place. Consider the amount of fuel you burn in the car before you get there. So that if it is not the major goal of cutting out reducing this what reduce your expense. If it doesn't reduce your expense, then that means it's not workable. Next thing is how to save cost on energy. Use electricity during off-peak hours whenever possible. It is often less expensive to do wash and run dishwashers at night during off-peak hours when energy use is generally low. So lower energy bills by turning off the lights in the rooms, by turning off the AC, or by lowering the ACs when no one is at home or when there is no heat. Use a programmable thermostat to control heating and cooling costs. Then set the thermostat to 65 to 70 degrees during the winter and 58 degrees when no one is home. Save energy costs by washing only full load of clothing that is used in washing machines and dishwashers. Don't wash small. Fine. Since you're using a dishwasher or a washing machine to wash clothes or dishes effectively, allow them to pile, then wash at once, then wash small today, wash small tomorrow. Because the time, once you on the washing machine, it consumes what the same energy as when you put in one clothes and when putting 10 clothes. So use the cold or cool setting whenever possible when washing clothing. So that's it to save energy. we check the lint screen in the dryer frequently. This prevents fire as well as allow the dryer to work more efficiently. Don't ever dry clothes in the dryer only for when the amount of time necessary to get clothes dry. So you're trying to save on energy. Why must I dry clothes dry when there is a sun? So better to sun dry clothes and leave the dryer. So whenever possible, hang clothes to dry on wet cloth line. And using energy efficient appliances whenever possible can also help to reduce cost. So don't always turn on energy, all these energy efficient appliances like your refrigerator, your television, your stabilizers, your MP3, your home theater, or the electric cooker. So you turn all these things off whenever possible to help reduce cost. They have cleanings, heating and cooling system inspected and maintained on a regular basis to ensure they are working effectively. Replace furnace or air conditioner ducts when dry. Use fans instead of air conditioners. Use energy saving shower heads and faucets. Take shorter showers. Don't leave water running when necessary. Turn off the water while brushing teeth and in between washing dishes. Defrost your refrigerator on a regular basis. Ice buildup increases the cost of energy as the refrigerator has to work harder to be efficient. Open and close refrigerator and freezer doors infrequently and quickly. Plan for what you need prior to when prior to open the door. So by following these cost saving suggestions, making and sticking to a budget and reducing debt, home health aides or personal care aides can help their patients and their family to meet their expenses without having to feel anxious. So when we follow these guidelines I've mentioned since and been to us since, we see that we will greatly reduce on energy usage. And energy consumption, one of the we consider one of the highest production. When you're able to reduce your energy consumption, home health aides and personal care aides can help you towards maintain your family budget without feeling anxious. So home health aides or personal care aides should follow the care plan guidelines as to what ways they are expected to help their patients budget and manage money. Always document tasks completed and money that is spent. And whenever you are in doubt, seek guidance from a supervisor. We have come to the end of this module. Just a brief recap from where we started. We talked about how to make the most effective use of family finances. And we discussed the introduction to that topic, where we talked about the duties of the family, of the home health aides or the personal care aides for the patients and their family. And we mentioned some places where costs can be reduced, such as grocery and how to save on groceries. Then we also talked about how to save on household costs. Then we mentioned a few things there, and we also discussed how to save on energy, and this was the final part of our discussion. We talked about reducing lights, reducing water usage, and everything. Thank you for your time and your listening. Have a wonderful day ahead.